So today we're going to talk about gastroenteritis. Gastroenteritis is defined as an inflammation of the lining of the stomach and both intestines. Now, most cases of gastroenteritis are infectious. They can be bacterial, viral, parasitic, but they can also be due to ingestion of drugs and from chemical toxins. The term gastroenteritis is a nonspecific term that's used until the cause is found for a more specific diagnosis. Now, this condition is usually self-limiting with bed rest needed, and depending on the severity of it, there may be concern for electrolyte and fluid replacement due to dehydration developing. Gastroenteritis can be dangerous to the very young and elderly, and worldwide, on average, between 3 and 6 million children die annually from infectious gastroenteritis. Symptoms and signs of gastroenteritis are anorexia, nausea, vomiting, diarrhea, abdominal discomfort or cramping, and fever. Initial gastroenteritis diagnosis is usually clinical, based on the symptoms and signs. Stool cultures may be used at times to try to identify a specific organism. Treatment is often directed at the patient's symptomatology. Viral gastroenteritis. Viruses are the most common etiology, the most common cause of gastroenteritis cases in the United States. The viruses cause typically a secretion of fluids and salts into the intestinal lumen, as well as malabsorption of carbohydrates, so this actually can contribute to the development of osmotic diarrhea. This form of gastroenteritis is going to produce a watery, non-bloody diarrhea. So let's look at etiologies for viral gastroenteritis. There are 4 categories of viruses that produce the most cases of viral gastroenteritis. They include rotavirus, calcivirus, astrovirus, and adenovirus. So rotavirus is the most common cause of sporadic, severe, dehydrating diarrhea in young children. And we're talking young here, folks, like 3 months to 15 months. Rotavirus is highly contagious, and it's passed through a fecal-oral route. Adults may become infected with this after being around infected infants. On average, the incubation period takes about 1 to 3 days, and then symptoms, when they're in adults, can be quite mild. Most of these infections occur during the winter, and what we see on average in the U.S. is that each year a wave of rotavirus illness usually is going to begin in the Southwest somewhere in the fall, like around November, and it typically ends in the Northeast in March. Now, calcivirus tends to infect older children and adults. The infections from calcivirus occur year-round typically. The most common settings for calcivirus gastroenteritis are going to be from restaurants, catered meals, nursing homes, in schools, cruise ships. Calcivirus is the principal cause of sporadic viral gastroenteritis in adults and epidemic viral gastroenteritis in all age groups. So we can see large waterborne and foodborne outbreaks occur with this. Person-to-person transmission also occurs because the virus is highly contagious. The incubation period is about 1 to 2 days. Now with astrovirus, it can affect people of all ages, but it usually tends to impact infants and young children. It's more common in the winter months, just like rotavirus. So we got some similarities here. Likewise, the transmission is fecal-oral, just like rotavirus. Incubation for astrovirus is on average 3 to 4 days. Now, adenovirus is your 4th most common cause of childhood, under the age of 2, viral gastroenteritis. It tends to infect year-round. And it also has a fecal-oral route transmission, just like rotavirus and astrovirus. The incubation is about 3 to 10 days. Now, this virus lasts for a while. It lasts 1 to 2 weeks before people typically recover. Viral gastroenteritis treatment is fluid replacement. Right? That's the recommended treatment for all these forms. Please note, children under 5 years of age, you don't want to be giving them sports drinks or carbonated beverages for rehydration purposes. Bacterial gastroenteritis is less common than viral gastroenteritis in the United States. So enterotoxins are defined as a toxin that's produced by bacteria that is specific for intestinal cells, and it causes the vomiting, the diarrhea, the nausea that's associated with food poisoning. Now, some bacteria, for example staph, may adhere, or they will adhere, to the intestinal mucosa without invading, and then they start producing these enterotoxins. So we have symptoms of nausea, vomiting, watery diarrhea, and as long as the bacteria are present in the GI tract, it's going to continue to produce that enterotoxin. So it may take some time for the body to combat the bacterium and then break down the enterotoxin to decrease the symptoms. So exotoxins are a toxic protein that's produced by a bacterium, and then it's released into its environment. And there are bacteria that will produce this exotoxin substance, and then they release it out into their environment. So then if somebody eats that contaminated food, the exotoxin will act on the GI tract and produce symptoms. So with exotoxins, this causes a problem without the bacteria having to be present, and they're not necessarily present in the contaminated food. The symptoms include the acute nausea, vomiting, diarrhea. The diarrhea typically comes on within about 12 hours of exposure, but it goes away within 36 hours. So it doesn't last very long because we don't have the organisms within the GI tract continuing to produce this particular toxin. Now, we can have other bacteria that will invade the walls of the intestines, and they will produce small ulcerations, bleeding, they will cause exudation of protein-rich fluids, secretions of electrolytes and water, and with these kinds of presentations, the diarrhea that's produced is usually going to be very grossly bloody and containing white blood cells and red blood cells. So, etiologies include various bacteria, as well as parasites, and then we can have chemical toxins that can produce gastroenteritis. So let's look at bacteria. The most common bacterial causes of diarrheal illnesses are Salmonella and Campylobacter. And exposure to these two organisms are most frequently acquired through undercooked poultry, unpasteurized milk, and undercooked eggs. Also, we can have exposure to these organisms through handling of reptiles and dogs or cats who have diarrhea. Now, other bacteria that can produce bacterial gastroenteritis include E. coli, and E. coli is typically transmitted through ground beef, unpasteurized milk and juices, as well as contaminated water sources. Now, person-to-person transmission of E. coli is common in daycare settings. That's why we need to have hand washing being done frequently and consistently. E. coli is the most common etiology of traveler's diarrhea, and it produces watery diarrhea that may be bloody, so we may have dysentery presentation with this. There's been times that E. coli stool has been referred to as all blood and no stool. Another bacteria that can produce bacterial gastroenteritis is Clostridium botulinum, or produce botulism. Now, this is often associated with poor home-canned foods. The symptom onset comes on about 18 to 36 hours after ingestion of the organism. Now, botulism may actually produce neurological symptoms, and the symptoms can actually be confused with Guillain-Barré syndrome or even stroke. If you'll recall, Guillain-Barré syndrome involves the autoimmune system being attacked, and we see it affecting the peripheral nervous system. So they may have symptoms of weakness, tingling, in the lower extremities especially. When it's severe, it can produce paresis, and they can have a really rapid onset. In fact, these patients can go from being asymptomatic to severe and having life-threatening symptoms within a 2-week time period. Also, Clostridium botulinum can be found in honey, so you do not ever want to give a child that's under 2 years old raw honey. Remember, until the age of 2, they don't have a fully developed immune system. Now, when we look at parasites that can produce this form of gastroenteritis, Giardia lamblia is the one we're going to really kind of focus in on here for just a moment. This adheres to or likes to invade the intestinal mucosa, and it will produce nausea, vomiting, diarrhea, general malaise. This can also be transmitted not only through contaminated water, but via person to person, like through daycare centers, for example. And then the final section of material is looking at chemical toxins. And this can produce gastroenteritis with exposure to things like mushrooms, plants, seafoods. Heavy metal exposure, like arsenic, lead, mercury, cadmium. Drugs can do this, especially long-term treatment with antibiotics. The symptoms and signs of bacterial gastroenteritis typically include a sudden onset of the symptoms. They will have anorexia, nausea, vomiting, borborygmia is common, abdominal cramping, diarrhea with or without mucus or blood, malaise, myalgia, and fever, especially with a bacterial presentation.